Joining me now is Reeta Roy, President and CEO of Mastercard Foundation, and Dr. Nkengasong, the Director of Africa CDC. Thank you both so much for joining us today. This is a wonderful partnership, a very important one for the African continent. I'd like to start by asking you, Reeta, about this incredible announcement that Mastercard Foundation recently made, a $1.3 billion partnership to advance vaccine equity and strengthen the health systems of Africa. Why did you decide to do this?
Largely was inspired because of the great inequities which we see between Africa and the rest of the world. As you know, less than 2% of the African population has been vaccinated, while in comparison to more than 50% in other parts of the world. So this initiative, Saving Lives and Livelihoods, has four major priorities. First, to purchase at least vaccines for at least 50 million people, to get behind the deployment of vaccinations for millions more across the continent. Third is to build a human capital for vaccine manufacturing in Africa. And fourth, of course, to build the institutions, particularly the Africa CDC, as it mounts this historic vaccination campaign.
John, how will this change the game for the continent? And how are you intending to overcome some of the logistical barriers that you're very familiar with in Africa?
I think the partnership with the Mastercard Foundation has the potential to increase the speed at which we vaccinate on the continent and the scale. In order to win this battle against the COVID-19, you need those two to all happen simultaneously. This potential capabilities is really going to be critical if we have to win the battle against COVID-19. And secondly is the institutional development component of this that is extremely important. We did not fight and win battles against a disease pandemic without strong institutions. And Africa CDC will benefit from this partnership by strengthening its core capacities and competencies.
What are some of the core capacities and competencies, Reeta, does Mastercard Foundation need to see happen and also need to focus on itself in order to make this a success?
Well, as you know, Zain, our main area of work at the Mastercard Foundation is really driving opportunities for young people, largely job creation. And we launched a strategy called Young Africa Works, which set out an ambitious goal of 30 million young people in dignified and fulfilling work by 2030. It's extremely difficult to move ahead unless we can also get this pandemic under control and really address some pretty fundamental disparities. So when I think of core capacities, I think about education for young people. I think about job creation, skills and job creation. And so this initiative, while it is extremely important in terms of driving forward vaccinations, keeping people safe, enabling all of us to get back to the work of economic recovery, in the process, it will also create work, create jobs for thousands upon thousands of people. It takes a lot of people to drive that kind of vaccination rollout across the continent, and longer term, more strategically, who will be involved in the manufacturing of vaccines, not just within facilities, but across the entire value chain of what needs to occur. So we are very, very excited, we're optimistic, but we also want to get to work.
And the human capital piece is absolutely critical, as you say, Reeta. John, beyond human capital, what else is needed to make sure that continental vaccine manufacturing is a success? Like, just paint the picture for us on the continent.
No, as Reeta said, we need to look at the entire value chain for vaccine manufacturing. That is from the research and development to production to manufacturing. And I think that is very important. Now, with respect to the production and manufacturing, we need strong partnership for technology transfer. Beyond human capital, we need to have the appropriate technology. Some countries in Africa already have some of these capacity and technologies, like in Senegal, South Africa, Egypt, Morocco, Tunisia, but we need to scale that up and build trusting partnership with the developed world so that they can transfer this technology into those facilities that already have and at least get them to speed so that they can start producing the vaccines that we need now and then prepare for the future. Because we know, as we've said all along, that we know we're fighting this pandemic, but there will be another pandemic in future. So we need to transfer the technology, not just for COVID-19 vaccine development, but for other threats that we face almost on a daily basis on the continent.
And John, those are some of the big picture issues that you have to grapple with. But if I could ask you just to be a bit more granular, now that this really incredible announcement has been made, what are some of the practical things that you're thinking about and doing on a daily basis to find a starting point to roll this out and make it happen?
I think there are a couple of things that we must do and do it quickly with this partnership. One is to secure the vaccine doses, which, as you heard Rita mention, as a continent, we have immunized about 0.8% of our population fully. That is people who have received their complete doses there. So we have to access vaccines there. The second thing we must do, and do it quickly, is to support countries to be able to use the vaccines. That is, build whole supply chains. Surge capacity for vaccination is critical. So we need to develop and harness the vaccinators so that they are ready to deploy those vaccines once they are available. We need to be able to strengthen vaccination centers so that people come into a clinic or an open space and be able to receive the vaccines in a timely fashion while respecting infection prevention, control, safe distances there. Those are very specific things that this partnership will enable us to achieve.
Mm-hmm. Rita, one thing that I was wondering is that why did Mastercard Foundation choose Africa CDC? You could easily have done this or invested in or worked together with COVAX, for instance. Why Africa CDC?
So the Mastercard Foundation has been working in Africa for over a decade, and we have a long-standing commitment that at least 75% of our partners will be African organizations. I think that's extremely critical for long-term sustainability because no one has the same level of investment and stake in outcomes as do people who live close to the problem or people from the continent. So that's number one. I must say that we laud the efforts of all organizations, of governments, of foundations, of funders, of COVAX, because this is an effort which requires everyone's input, everyone's leadership. We had a terrific experience working with Africa CDC early on in the pandemic when we came together in a partnership to do two things. One was to really access, purchase, and then distribute rapid tests, PCR tests across the continent, as well as to train healthcare workers at that point in time in testing and tracing. And that partnership demonstrated to us that Africa CDC, under John's leadership and the capable staff that are there, are an organization which is really all about getting things done and really focused on delivery. So we were really, really thrilled, and we are grateful that we can have this partnership with Africa CDC.
And with the partnership, John, what do you see, sort of looking far down the line, as the future of Africa's overall pandemic preparedness? Because this is something that is going to lay the groundwork for, things to come that will give you the muscle and the support to do what the continent needs and lead it. So just talk a little bit about the preparedness now and where you hope to be.
So in essence, you want us to talk about preparedness for the future and for future pandemics, which is essentially what we as Africa CDC and the African Union are saying. As a continent, we need a new public health order. A new public health order that will facilitate us to strengthen and enhance our ability to manufacture not just vaccines, but diagnostics and the pharmaceutical area. We need a new public health order that will enable us to scale up our workforce, public health workforce skills, so that we can develop new skill sets for epidemiologists, what we call frontline responders. A new public health order that would allow us to develop a national network and regional networks of national public health institutes and build relationships with the private sector. If we do those four things, then we are preparing ourselves to fight this pandemic, which is terribly unpredictable. and it's terribly uncertain where we are heading to, but it will enable us to be able to be well equipped to respond to subsequent outbreaks and pandemics.
Reeta, your leadership and your vision at the Mastercard Foundation is quite admired on the continent. You're one of the more effective foundations on the ground. Could you tell us a little bit about your approach to social enterprise and partnerships on the continent that I believe is quite different to some of the other organizations coming in and trying to operate in Africa? I think it's important to articulate like the approach and why it's actually been working on the continent.
Thank you so much for that question, Zain. I think I'll just start by saying that any organization seeking to do work in a part of the world needs to, the first thing we need to do is listen, ask some questions, but really listen and seek to understand. And where possible, get as close as possible to problems people live with. See them firsthand, listen to the people we seek to work with or seek to serve, what their ideas are, how would they solve the problem if they had the means to solve the problem. So that's number one. I think second is really working in partnership. And by partnership, I mean really collaborating, not coming in and assuming that we have the answers just because we have resources. Resources can only go so far unless they are viable solutions. And so that partnership which takes on board respect for the other, understanding their views, incorporating ideas in solutions. That's been part and parcel of how we've tried to work over this past decade with some success. And that's part of the journey moving forward for us. The other critical piece is we transformed ourselves as a foundation when we announced Young Africa Works and started rolling it out. We were based largely in Toronto, in Canada, and through this partnership, working on Young Africa Works, we opened up offices across the continent, we hired wonderful staff, and we relocated our senior leadership to be based here on the continent, including myself. So that's been part of our journey, part of our learning, and it's been extremely rewarding and certainly very, very enlightening.
And speaking of trying to get greater understanding, I'd like to ask John. John, you're Africa's Dr. Fauci, right? And I would like you to explain to all of us, what are some of the things that you have to think about when you wake up every day on a continent of 55 countries, different situations with vaccines, operating unilaterally and in groups and with the African Union? And what are some of the things that worry you most every day when you look at what's happening on the continent?
I mean, there are a couple of things that gets us awake all night, and the following morning, where you go to your emergency operations center, you are looking at the numbers. Which direction are your numbers heading? Are they going down or they are going up? And if they are going up, in which countries are they going up? And then if they are going up in a certain countries, can they fight it? And what must you do? So in other words, where are the hot spots that you must deploy people very quickly so that they can work with that, they support the government of that country to squash it before it becomes another catastrophe. So I think those are the kind of things that you are watching and tracking every day when you start up your morning with your emergency operations center staff, tracking the numbers, the figures, where it is seeding, the virus is seeding itself. Then you're also looking at countries that are vaccinating. Where are they using their vaccines with speed? Are they organized? Where can you help them to support them so that they can put needles into the arms as much as possible? So those are the kind of things that we look at every day when we start our emergency operations center.
John, thank you so much. We don't know when you sleep because you're always out there, you're always on the front lines, working so hard for the continent. Thank you so much, Dr. John Nkengasong, Director of Africa CDC, and Reeta Roy, President and CEO of Mastercard Foundation. And congratulations to you both on this outstanding and important partnership. Thank you.
Thank you. Thank you so much.
Thank you very much.